Well, Ravi and Cheryl, the president deeming this a historic announcement as he stood up there with the Health and Human Services Secretary. However, doctors leading into this announcement were concerned this would cause confusion among expectant mothers and, frankly, some guilt for those who have children impacted by autism. The president saying the FDA will start to notify physicians about the use of acetaminophen, more commonly known as Tylenol, by pregnant women, is believed to be associated with an increased risk of autism in babies. The president going as far as to give direct medical advice to expectant mothers, telling them not to take Tylenol unless they have a very high fever and if they can't, quote, tough it out.
So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's, for instance, in cases of extremely high fever, that you feel you can't tough it out.
The FDA will issue a physician's notice about the risk of acetaminophen during pregnancy and begin the process to initiate a safety label change. HHS will launch a nationwide public service campaign to inform families and protect public health.
Physicians at Lurie Children's Hospital acknowledging there are genetic, environmental, and social risk factors for autism. But Dr. Andrea Spencer saying while autism rates have increased over the past decades, Dr. Spencer, a psychiatry and behavioral health expert, says acetaminophen is not the cause of autism or increasing rates. She and other doctors now cautioning families to continue to trust their medical providers.
I think one of the things that I worry about is that people will be scared of using acetaminophen and then use other things that we actually have more evidence are not safe in pregnancy. And so I do want to really caution people to be careful and make sure you're going to your medical providers and asking them what's safe and trusting them.
In a statement from the American College of Obstetricians and Gynecologists, they say in part, quote, today's announcement by HHS is not backed by the full body of scientific evidence and dangerously simplifies the many and complex causes of neurologic challenges in children. It is highly unsettling that our federal health agencies are willing to make an announcement that will affect the health and well-being of millions of people without the backing of reliable data. That statement continuing to say in the 2 decades of research of the use of acetaminophen in pregnancy, quote, not a single reputable study has made a definitive conclusion that the use of acetaminophen has caused neurodevelopmental disorders in children.